My name is Shazane, and I am back in my car filming again. This week, this is a pregnancy diaries. This week, I'm actually going to be doing week 37 and 38 together because today, the day that I'm filming this, I don't know necessarily the day that this is going to go up, but the day I'm filming it, I'm now on my 39th week. Wait a minute. What was last week? 37? Okay, I'm sorry. So this will be 38 and 30, week 38 and 39. Because I tried to film last week for week 38 and I didn't have time at all. And now I'm on week 39 and God knows, like, I could go into labor tomorrow. So I might not be able to get like a week 39 up for you guys. So I'll just do the 2 weeks all in one because honestly, I'm on the home stretch. So really nothing is gonna change. So I'm just cutting through a gas station real quick. I just gotta pay attention because it's kind of small. Un momento, por favor. Okay, we're good. Alright, so basically what's been going on? Basically anticipating labor now. I've been kind of anticipating labor since like week 37 because you can go in at that time. And I didn't know if I was going to be one of those women who went in earlier or later or whatever. And I still don't know if I'm going to go completely full term. I don't know if I'm going to last to next Sunday before she comes. Who knows? So I've been kind of a little bit cautious about going out places, especially by myself, and especially far away places. I try to stay relatively close to my home in case I need to get in touch with anybody. But even so, like, in case my water breaks, I don't want to be out in public and just have my water break. I think that, oh my gosh, that'd be so embarrassing, and I'd rather it just happen, you know, in the comfort of my own home, where I'm not embarrassed and I can just I can kind of react in a better way. I don't know. But also, like, my mucus plug, if you know what that is, has not come out yet. And I have been like doctor Googling myself this entire pregnancy pretty much because I mean, it's I know you're supposed to like talk to your doctor about these things, but it's embarrassing. I mean, he's already like in my hoo-ha half the time checking me out when I go to the gyno and everything, but it's like, I don't know, I don't want to have to call for every single question. So I actually just Googled this morning. I was like, 39 weeks pregnant, no water broken, no mucus plug, is this normal? People say, I mean, you'll get a whole bunch of different answers. Most people will just be like, oh, just ask your doctor. But a lot of the people said that half the women, a lot of times their water doesn't even break. Like, the doctors will break it for you. And then a lot of women don't lose their plug until they go into labor, active labor, which I guess would be a better thing because the plug is like preventing infection from getting to the baby. So I'd rather keep it for as long as I can so she's, you know, away from any kind of infection for as long as possible. So I feel like I'll be one of those women who's gonna lose it once I go into labor. A lot of people have been asking me, not necessarily on YouTube, but just in real life, if, you know, like I'm nervous or whatever. And of course I'm nervous because I know it's gonna be painful. It's kind of inevitable. But I kind of have a way of being able to, okay, hold on. This person just cut me off to take a left because he didn't want to wait. Stupid driver so much. I kind of have a way of not thinking about it. Of course, I'm anticipating labor. I'm excited to meet my baby more than anything. I've never looked forward to anything like this in my entire life. But people are like, oh, you know, people are not helpful at all. People are going to be like, it's so painful. Like, are you going to take any pain medication? Like, what's your plan for that? And it's like, I don't know. I know it's gonna hurt. You don't have to keep reminding me, because that's just gonna make me kind of freak out before I even go into labor. So I've been able to kind of put that mindset behind me and not worry or anticipate labor. But I know the second my water breaks, or I know I'm going into labor, I'm gonna cry. Because then all that emotion that I have not been showing towards labor, like all the anxiety and the fear and everything, is just gonna flood to me all at once. And I'm just gonna cry. I'm just gonna break down and cry. I know my body. I know how I react to stressful situations like that, and I'm just gonna cry. So basically, I'm not upset about it right now. You know, I'm not worried about it or scared about it. But I know the second I know it's happening, I'm gonna get really, really freaked out. I think I've mentioned pain medication to you guys at some point, maybe last week. But I told you guys I'm pretty much saying screw a birth plan. I couldn't tell you until after the baby's born if I am going to get an epidural or get any kind of pain medication. I'm going in there with the mindset that I'm not, but I don't know how much pain I'm going to be in, and I don't know how easily I'm going to be able to tolerate it. So I might not, and I'm going to make a video afterwards explaining, you know, everything. I, you know, wish I could find a video out there that explains labor in a way that's easy to understand. So I'm going to make that video for you guys. You know, I'm going to tell you all the details, not to scare you, but just to kind of inform you and give you a better idea of what to expect, the things that they don't tell you. So, I don't know. Anything been going on differently with my body? Not really. My stomach has just been getting tighter. My mom's saying they're contractions, and I don't know what contractions is supposed to feel like. I know they're not like real contractions, so they might be Braxton Hicks, or they might just be the baby pushing up against my stomach. But my stomach will get really, really tight all of a sudden, and like last for like a minute or so, and then relax again. But I don't know. They're not painful. It just kind of sucks. It's uncomfortable more than anything. So my body's been doing that. And what else? Just back pain, really. Heartburn has settled down quite a bit. I'll still get it from night to night. Same thing with leg cramping and stuff, but not nearly as bad as it was before or anything. But I don't know. At this point, I'm just getting very impatient. Because I just want her to be here, and I loved being pregnant for the, like, feeling her. She's actually moving right now. Feeling the baby inside you. There's, like, nothing like that. But other than that, I really didn't enjoy pregnancy. I don't know, you're just kind of uncomfortable. You don't feel sexy. You don't feel... I don't want to say I don't feel like a woman, because I should feel like a woman, but like I just don't fit into the outfits that I want to wear. I mean, that's all kind of like selfish stuff, obviously, because, you know, I'd give up anything for my baby, and that includes, you know, not being able to wear an outfit I want to wear. But I'm just really ready to be back in my own body, basically. What else? Trying to think. I don't know if I should let this guy go. I'm probably just gonna be a dick. This light sucks up here, by the way, so I've been sitting at this light for quite a while. But yeah, so we're just anticipating. I'm probably, I don't know, I'll probably like vlog in the hospital after everything. I guess like after all the visitors. So I'm not sure where that cut me off. It was basically telling me to shut up. I told you guys pretty much everything, so hopefully the next time you see anything pregnancy related on my channel, my baby will be here. I'm excited to show you guys her, and yeah, so thank you guys so much for watching, and I'll see you next time. Bye!